Happy Wednesday, everybody. We're almost to the end of July, and by the time I come back with you, it will be August. I can't believe it. Welcome to the end of July and Wednesday, July 29th. I am Jen Rumbolsky, the director of the Crosse County Health Department. Glad to be with you today. I will start with our numbers. I'm going to switch it up a little and start with Wisconsin today. So on the Wisconsin state level, our total number of positive cases is 51,049, which is up 870 from yesterday. We have an increase of negative cases from yesterday of 13,824. Ever hospitalized 4,539, which is up 46 from yesterday. Total deaths in the state, 911, which is up 5 from yesterday. Active case percentage is 19% and recovered cases 79%. La Crosse County's numbers, we have 9 new cases so far today. So we have been holding fairly steady with case numbers, which is good news. Our total that are active and at home is 111. Active and hospitalized is 5. We have 650 recovered and 1 La Crosse County resident that has passed away. So our total case number positive is 767. And next I want to talk a little bit about the Compass update. So I spoke a lot about Compass on Monday. My focus now will be on specifically items to share with you from today's update. So I do have some good news to share, even though we have not yet come out of red. I want to share some facts with you about items in the Compass. So our doubling time, which is the time it takes for us to double our number of cases, has increased from 26.5 days to 32.5 days. Our percentage of positive cases remains below 10%. It's at currently 6.7%, so that is good news. Our overall case rate has decreased from 130.5 cases per 100,000 to 127.1 per 100,000 people. And just to note here that that case rate is a factor of burden, the number of new cases, and the trajectory is whether or not our cases is going up or down or staying the same. So this really means that our cases, we still have cases being transmitted in the community, but overall it is less over the past week or during the past week than it has been prior. In order to turn the light on metric number 3 to yellow, which is metric 3 is the one that was adjusted last week that looks at case trajectory and burden. So again, what I just mentioned, which is the case rate and the percentage of change. So that tells us if we're going up or down. We need to see a reduction to less than 100 cases per 100,000 population, or 118 cases in a 2-week period. In the healthcare status aspect of the Compass, we remain yellow this week in that bucket, and the average critical care bed capacity has never dropped below 40%. We do see it under 40% at this time. It's at 34%. And the metric for that one is 30%. So we want to not see that go below 30%. We have added a graph underneath the hospital capacity tab that talks about availability of ICU and intermediate beds, ventilator availability, and regional hospitalizations. Also, we added a graph that talks about, we had a question from Monday's briefing about what the average length of time is from the time someone gets tested to the time that it results, or the results come back to the resident. So there is a graph that shows that as well. In the public health status, so this is really about, can we contain the infections that are occurring? We do remain in red this week, but again, some good news, I think, there. First of all, 85% of cases and contacts are reachable by public health within 24 to 48 hours. but we are closing the gap. So I want to share that 3 weeks ago, the percentage of our ability to reach cases within 24 hours was 49.7%. 2 weeks ago, that was 74.5%. And as of today, it is 81.9%. 90% is the goal that changes that light. So I think we are making good progress in that area. So I'm glad to see that percentage getting better. And then lastly, I just want to share that we have done a lot of work to hire on new staff to help with disease control, the disease investigation and contact tracing. We're not complete with that yet, but we do have a significant amount of additional FTE. Our goal is to add 24 FTEs total, and I don't have the exact amount, but it's somewhere around 17 FTEs that we have added over the last 4 weeks. And that is greatly helping us get those percentages up for being able to reach cases more quickly. We've done some other really creative things as well that I've talked about in the past, like the HIPAA compliant JOT form that we have now for cases and contacts. And so if someone is diagnosed with COVID-19, one of our healthcare partners actually, when they contact the patient, gives them that link or goes through that form with them, and that immediately submits information to our office that includes critical pieces about their contacts as well as where they have been in the community. So that way, even if we can't get to them right away, we have the most critical information and they have been reached then and understand their isolation recommendations and instructions. So some of those types of tools are also helping. So we're working really hard to get those numbers up. So that is the update on Compass for this week. So it's good to see some progress that we're making there. Second, just wanted to do an update on our business recognition initiative called Check the Spread. We now have 163 businesses that have pledged, and I'm really proud in this community that many businesses have pledged and signed on. So thank you to all of those businesses. If you go to the website, checkthespread.org, you can click on Safe Businesses, and all of those that have pledged are listed there on the website. So thank you to all the businesses that have taken that step to support our community. Next, just wanted to announce a reminder about the Mask Up initiative, Mask Up La Crosse. If you haven't already sent us a photo of you in your mask, please do that. And there is a prize for those that submit. We'll draw for a t-shirt that someone from our community made that's really nice. So please send us your photo of you in your mask. And you can send that to our COVID inbox or via social media. And the COVID email inbox again is covid19@lacrossecounty.org, or of course on our Facebook page in the private messaging feature. Then, as I have done in the past, I want to share my quote for the day. Today's quote comes from Mother Teresa, actually. And she has this good quote that says, "Yesterday is gone. Tomorrow has not yet come. Today is all we have. So let us begin." And I like that quote because it says, it's kind of a carpe diem, seize the day message. Let's not dwell on the past. Let's not worry about the future. Let's be present in the moment, which is both really healthy for us as well as much more productive. So hopefully that's a quote that resonates with you. And then also my gratitude check for the day. On Monday, it was what's in your kitchen. Today, I'm gonna say what's in your yard. So you can look out of your front window or your back window of wherever you live, or where you work if you'd like, and just look around and see if there's something that you can find that you're grateful for. Perhaps it's a birdhouse where you see certain birds that bring you joy, or maybe it's a picnic table that allows you to have a spot to sit when you're outside enjoying the sunshine. So think about what's in your yard that you might be grateful for. And with that, it's kind of a short update today. I will take questions from our media partners and public.
Hey, Jen, it's Rick at WIZM. How much input, if any, did you have on the outdoor cafe program or plan that's they're kind of looking into for downtown La Crosse and the north side, just essentially putting businesses on the street?
Yeah, I have not had input into that. I don't know if members of my team have, but I think anything that helps our businesses be able to expand their space in a safe way is a good thing. So for example, if you can only have so many tables inside and you can do that more outside, and that allows for that open air feature, which helps decrease the spread of COVID, I think those are good features to be considering.
Hey, Jen, Dustin from WXOW. Just with the county-wide mask orders we've seen in Dane, Milwaukee, and Brown, not yet facing legal challenges in court, is there talk with the La Crosse County board about implementing a mask ordinance? I mean, we're looking at thousands of college students returning next month. They may have to mask on campus, but what about, going off campus then?
Yeah, so Dustin, there are a number of pieces that are being talked about. And those pieces include the plans that higher education are working towards. So we just again today had a meeting with Western Technical College, UWL, and Viterbo, and talked through specifically isolation and quarantine plans. We are doing those level of planning with our higher ed partners. I am concerned about that many students coming to our community. We are working a number of angles relating to that. I am aware, of course, that UWL has a requirement for masks on campus. There has not been significant discussion with the county board about masks. We do still wait for the Wisconsin Counties Association Public Health Committee to finalize their review of the health officer authority. I do continue to let all of you know that wearing a mask is important. There is more evidence coming out all the time about the value of face coverings and masks. I of course have seen lots of progress made with K12 schools and businesses in our community requiring masks. I'll just give a shout out to Planet Fitness that they have had some challenges with cases in their establishment, but their corporate, I think nationwide, has made the decision to require masks, and those are important steps towards decreasing the spread of COVID-19. I don't know what the next steps are for masks in La Crosse County specifically. It certainly is something we really want to see everyone using and wearing when they're out of their homes. It's possible that that will move forward, but again, there's really nothing at this point to share specifically about any communications or any actions coming forth.
Rick again, you mentioned Monday. Did I miss it? Did you have total hospitalizations? The last time I remember getting an update, it went from 29 to 33, and now I don't know. Maybe I missed it.
No, I didn't say that, Rick. And if that was one of your questions from Monday and I missed that, I knew that one of the questions was the turnaround time on tests. So if I missed that, I apologize, and I will get that for you. Total hospitalizations. What I did was you're saying for La Crosse County, I'm remembering that we are reporting current and we want to report total. And I think my team said they would do it once a week was the plan, but I didn't get the actual number for total. So I'll get that for you, Rick.
Justin with WKBT. I know earlier this week you had talked about there's tons of moving pieces in terms of trying to get kids back in school safely. I guess and you had mentioned that there's a lot of factors. I was wondering if you might be able to share some ideas that you might have had when talking with some of these districts about getting some of these kids who, maybe live out in the country and don't have access to internet, or some of the kids that are coming from low income homes that just have no way of being able to afford some of this gear that might be necessary to be able to perform in the classroom at this time, especially virtually. I guess if you had any plans or kind of any updates on maybe some plans that are being enacted for that.
Yeah, so a couple of thoughts. First of all, Carol Drury from my office is typically the liaison with K-12 schools. I haven't met recently with the entire group to review and look at their plans. What I can say though is that we have recently looked at and did update in the Compass that went live today, the K-12 schools line. And so you will notice that that is different. We have also had discussions about whether or not we should add additional information around what we might call emergency daytime services for the intention there is for at-risk students, those that might really be struggling with online learning, or those that might be challenged in other ways. There can be a variety of other factors. If that could be done safely in a way, especially when in red, where schools are recommended to not be in person. So we're discussing that because we know that there, one size does not fit all for every student and family in the county, and we want to make sure that we can support all of those families. That is really a partnership, because that is something that I would just say the schools already worked really hard on in the spring when they had to be shut down. They found a way to support the food insecurity needs. And we can always do better as we learn more. So those are some of the conversations that are happening, along with other activities that can happen in school that aren't specifically connected to the education learning environment, such as extracurricular activities. And we're looking at how contact sports, the level of contact, what level of risk that means, what precautions should be taken. Additionally, besides contact, what is really more important is what types of activities can be what we call aerosolizing. So when we remember that COVID spreads the most from person to person by droplets that are within 6 feet, that's the distancing requirement, because those droplets can't travel as far. But if you're engaging in exercise or some aerobic activity or singing or anything that pulls that air out of the deeper part of your lungs, where those droplets may be able to travel farther, those aerosolizing activities really do require some special attention to assure that we can decrease the risk of spread. And so we are talking about what activities those are. And it's not just sports, it's also other extracurriculars. And of course, music comes into play. So we need to talk about those activities, and that will be on the agenda for the next meeting with K-12 school leaders coming up.
Hey, Jen, Dustin with WXOW again. Just want to go back to colleges real quick. With the testing, do we know yet whether that'll be on campus, handled by the county or the hospitals, or a combination? And do you think the county is prepared for the increase in students next month?
Yeah, it's a really good question. I don't specifically know what testing, we haven't discussed testing specifically in that higher ed strike team that has only had 2 meetings so far. Today's was focused on isolation and quarantine, specifically looking at what number of students they will have on campus, how will they respond for those that may need to be in quarantine or isolation, those sorts of things. Testing will be one of the next topic areas, but what I can tell you is that it is not adequate for the need, and we are concerned about it. I know that that UWL in particular is really working on trying to develop a contract to make sure that they have capacity there. But we are concerned about the number of individuals that are coming to our community. And again, I'm having some communications and working on that because we want to be as prepared as possible once those students are in town. And it goes beyond preparation on campus. It includes understanding that there are behaviors that are risky that that young individuals engage in, and we need to decrease the risk wherever we can, and some of those areas we don't have as much control over. I will just say that this is one of the reasons why some of our strategies have been around engaging businesses and asking them to look at those guidelines and take that pledge to assure that they are doing what is necessary to prevent spread in their establishments, as well as working with engaging the 20 to 29-year-old age group, which is still in progress, and hopefully increase the use of mask wearing, especially off campus. I think that it is important to note that UWL has a requirement for masks on campus, but just controlling what's happening on campus won't be enough. So I do have concerns. We're working as hard and fast as we can to address each of those areas in terms of the number of students, their housing aspects and needs, and congregate settings like residence halls and dorms, isolation and quarantine protocols, testing will be on the agenda, and other items as well, including communications to staff and students. So there's a lot of work there to be done, and in a short time frame. So we are working on that.
Justin with WKBT again. I'd also like to bounce back to students, but of the younger age group. And I apologize if this might be outside of your realm, but has the county been talking with any kind of daycare centers or of the sort of, kind of taking care of those younger age kids? I know I was out on a shoot earlier and was talking to a gentleman who, unfortunately, his wife is going to have to stay home, and he's been taking on about 60+ hours a week of work to be able to provide for all of them, I guess. I understand if you're not able to kind of speak on that, but do you know of any resources that parents of these younger age kids might be able to maybe get a hold of, and maybe, get information of that sort, so that way, they don't have to make some of these tough decisions, or at least have the resources to be able to kind of help their family through this time?
Yeah, and first of all, I just want to say that we certainly hope that we're not going to be in red for, the entire fall and winter here. We don't think that that's going to be the case. I think the planning is predominantly around being in orange, in high risk, and that there will be time periods when we will bounce into red, and we need to be flexible. And then to note that we do have resources in our community. I think about counties around us that have even less than we have. Enough resources is a problem everywhere, especially for care for those students that may not be in the school setting while they are virtual. So I recognize and appreciate that concern. It certainly will impact far and wide. Even in our health department, we have a lot of young individuals with kids. Individuals with young kids, and they have to make arrangements to figure out how to support that need as well. So I totally understand that and appreciate it. I think there are resources that I have heard are willing to step up and try to support that need. And that is one of the discussion items relating to that emergency day services line that I was talking about before. How to assure that students have supervision to keep them safe while they are engaging in the online virtual learning environment. So yes, a lot of planning is going there as well. And I already see some community resources that are looking to support that need. I don't know if that will be enough, but we do recognize that that is one of the challenges.
Any other questions for Jen today? I don't see any, Jen.
Okay, well, I just want to say thank you to everyone. So my gratitude end for today is to say thank you. I know that there's a lot going on around a lot of different areas that relate to COVID. COVID can be overwhelming, and I just want to remind us all to take a deep breath and to remember that we are not alone in this fight, and to thank all of you for the work that you're doing, and recognizing that this does impact everyone and we can't soften all of those impacts. But again, that's what community is for. And there is no better the community than La Crosse County. So I think we continue to work together, and my gratitude goes out to you today. So thank you all, and I hope you have a good rest of your week, and we'll see you next Monday.